Welcome to Girls Night In. Hopefully you've had a chance to get a bite to eat. Maybe you have gotten a glass of wine or a cup of coffee or iced tea, whatever it is that you like to sip on while we have our program. So thank you so much for joining us. And for those of you who may be watching this on the replay on our YouTube channel, same thing for you. If you have questions, just post them in the comment below. I'll get an alert on those and make sure that we get those answered for you. Thank you for being a part of the Red Heart Mamas. This is a program that we are doing especially for you. It is National Women's Health Week, and all week we have been talking about women's health issues. And tonight we are presenting a special program. I polled the membership and asked you what kind of a program you would like this month. And many of you said that you would like one of our Doctor Chat programs. And I wanted to get a female doctor to come on and talk with us this week. And so I am excited because we've been talking about wanting to collaborate and work on some things like this for a while. And it is with great pleasure I'm going to introduce you to a very special lady. Her name is Dr. Shantala. I'm going to try to do the last name. I've known her for a while, but she knows I have trouble. But Gopalakrishnan, how did I do that time?
You did it great. Thank you.
I don't know why I have such a hard time with that, but it's terrible. I mean, you don't mess up my name. I guess I just need to practice it more. But Dr. G is how we affectionately refer to her. She is an internal medicine physician who, believe it or not, has worked for Atrium for like 17 years. So I guess that means you started when, like middle school?
I wish.
You wish. Well, thank you so much for joining us and for giving us your time this evening and giving us an opportunity to talk about something that I know that you are very passionate about. But before we get into that, let's learn a little bit more about you. Tell us more about Shantala or Shantala. See, I got that wrong. I'm just awful today.
No, it's perfect, Sheila. You are an amazing woman who inspires me to do, be part of the Red Heart Mama. So first of all, I would like to say a big thank you to you, Sheila Caldwell, for forming this, heart-to-heart group and the Red Heart Mamas and inviting me to the Girls' Night In. It is my absolute pleasure and privilege to be part of this chat and talk about how we can, be our healthiest, person and live our best life. And so, it's like Sheila said, I've been an internal medicine physician for 17 years, and I was lucky to start at Carolinas Healthcare System, which is now known as Atrium. And I worked inpatient, that is, they call us hospitalist because we take care of patients who are too sick to go home after they come to the emergency room. So it's my job to make sure they get well and go home feeling their healthiest, best, and safest. And so having done this for 17 years, my passion now is how do I keep my patients out of the emergency room at home and teach them how to stay healthy at home rather than come to an emergency room when sometimes it's too late. So, and also very, very expensive. So we have to figure out a way to increase the awareness and education in this beautiful community that we live in. And Sheila has given me a chance to do that. So I'm very grateful. And I look forward to doing this many, many, years moving ahead. So let's hope for the best. And yes, we had some technical difficulties, but here we are doing well right now. Take 2 is working for us. So awesome. So thank you again, Sheila. I'm ready to, rock and roll.
Great. And do have some that are joining us on our Facebook Live through our Red Heart Mamas group and some guests here on Zoom. So we appreciate you all coming in. So I do know that you are also married to a doctor. What is that like to have two doctors in the family? Are the schedules just crazy?
Yes, but by grace of God, we've been able to coordinate it in such a way that we do have a family life. We try to work the same week. So we, of course, had to make sure we had some help at home. And, luckily our children are now teenagers and they are learning how to be my version. It's called mini adults. Uh, by grace of God, I was able to start doing telemedicine, taking care of only COVID patients from home since March of last year, since the pandemic started. And so I feel like that is my service to North Carolina. And I've taken care of thousands of COVID patients. But, once again, I have been able to send them home healthy. And, Atrium has done a fantastic job trying to create this telemedicine. And we were able to prevent the chaos that happened in New York because we were taking care of patients at home. And this is why, even though we didn't have hospital beds, we were able to go to their home and take care of them. So overall, being married to a doctor, I think I get the understanding. He realizes how crazy our lives are. And so we do share that understanding. But it's also funny that, I still have to take care of my husband just like any other husband. He does not necessarily do everything he's supposed to do to stay healthy. So he's one of my kids.
I think a lot of women can identify with that, and the reason why I brought that up, other than I think the world of the both of you, and I know what incredible physicians you are, but understanding the demands, on the type of positions that you have, there are a lot of women who are under those same stresses of working and children, and you're taking care of everybody and everything. And I know for you, one of the things that I really have always appreciated about you is you take that very whole body approach to health. And a lot of times I think over the years we go to our primary care physician and it's very general, but you don't necessarily talk about nutrition, or you might not talk about mental health. And with you, I know that that's something that you look at that whole person. So for a woman who may be watching this and it's at the end of the workday and almost the end of the week, and the stresses are there and how that impacts our body, talk to us about how you, as a woman, not necessarily a doctor, but as a woman, how do you balance all of this and keep healthy?
So, you have to put in, it's an excellent question, and it's a very relevant question to everybody's day to day. I do use my medical knowledge, of course, to help me, but I would love to share that knowledge also. And I always share it with all my patients on a daily basis. It's a very simple formula. You have to, make time for yourself at the end of the day, whether it is a 30-minute walk or spending time with your pet, whether it's a cat or a dog or gerbil or whatever that you like, or a hobby, because you have to have a way to de-stress, because we all think that we got this under control. I used to think that until I started meditation, and then I realized I didn't have it under control. Because I felt very different at the end of the meditation experience. I felt free. I felt liberated. All those knots that I had in my body were just open now, and I was free again. So we have to make time for meditation. And I do give a disclaimer, I'm not promoting meditation just because I'm of Indian origin. But I have tried meditation. I practice meditation. I'm teaching my children meditation, and I practice yoga. And not only because I don't want people to misunderstand that it's because I'm Indian, because it's not because of that. I have practiced yoga after not practicing it for many years, and then I started doing that because I was having lots of aches and pain sitting on my office chair in my hospital or in my home office, and there was a time when I couldn't even get up from a sitting position. And if you just look at me standing, I look like a very healthy person. But the reality was different. I was stiff, I was inflexible. So I had to teach myself how to do yoga stretches, something as simple as touching your toes. That's it. Made a world of difference. All the aches and pains gone without Tylenol, without Motrin. I mean, that's all you needed without the therapist, without massages. So it's huge. So suddenly I realized, wow, this is big. And now I have made it my mantra to share it every single time, every patient that whose life I get to interact in and touch upon for any reason, even my friends, my family. So so anybody who knows me, they'll hear 10,000 steps, yoga, meditation, get a puppy or a hobby or so these are very simple things which we all know, because the truth is we are all Google MDs now.
we all have Google MD. That might be a blessing and a curse. I'm not sure.
But it's very, very hard to apply this on a day-to-day basis. Mm-hmm. It's called conscious living. You have to remind yourself, and you have to, in a good way, get obsessed with good health and stress management,
And I know that May is also, National Mental Health Awareness Month, as well as National Stroke Awareness Month. So there's a lot of that, that all ties in, with women's health. When you see your patients, and I know you see a wide, variety of patients, different ages and backgrounds, what are some of the common things that you see that that women especially could be doing to save themselves a lot of trouble down the road? What are some of the preventative things that you teach your patients?
The preventive things are really all, it all boils down to being on the right diet, because you are what you eat. You have, you were born with most of us, by grace of God, are born with a healthy body and mind. So we have to teach ourselves how to treat our body and mind right. So you have to eat right. The father of modern medicine, Hippocrates, said this. I wish I could take credit for it, but but I can't. It's called, your food should be your medicine. And the second part of it is, your medicine should be your food. So the first part, food should be your medicine, is that you have to eat right. There is a reason you have to avoid sugar, because it's inflammatory. It's not good for you. And if you start your day with sugar, then you end up eating sugar every 2 hours, because now your body is in that mode of craving for sugar. So kind of you're doomed. You will never stop eating sugar. So you have to sort of save eating sugar, if you really love it, at the end of the day, because you're going to go to sleep after that. And of course, in moderation. So you are what you eat. Your food should be your medicine. So you have to try to eliminate fried food and simple sugar. I tell them, simple. I explain it very simply. I just say, eat the sugar that God made, that nature gives you, fruits, vegetables, because there's some vegetables like carrots that are sweet, So eat the natural sweets, that nature gave us, and antioxidants, of course, that takes your ability to screen your diet to another level. But if you focus on eating fruits and vegetables and then some protein, legumes, grains, you've made it. I mean, you really don't need to do anything more than that. Then, of course, diet. After diet comes exercise. You have to burn what you eat, and especially if you're eating a little bit excess. Most of us are spending hours and hours sitting at a desk, bad posture, and we are now on the internet more than outside. So what happens? We're staying up late watching Netflix and Amazon Prime, and what are people doing? They're snacking. What are they eating? Ice cream and chips. They eat a salad at 8 o'clock, and 12 midnight, it's ice cream and chips. So obviously nobody's burning that. So once again, so I try to tell people you have to teach yourself to eat right, exercise right, sleep right, and drink right. So you have to drink water. It's very hard to keep counting how much water you're drinking. Very few of us obsess and have like a gallon container next to them. So I just tell people, it doesn't sound very, good, but I said, your pee should be light yellow in color. That's it, because that most people can see. So I know it sounds gross, but you just, that's how you keep up with the hydration, so, and then, so trying to, once again, keeping it simple, you have to eat right, exercise right, eat and sleep right and drink right, so, and think right. So that you can do with meditation, so it's simple, but very difficult to do on a day-to-day basis. I mean, even I slip up. Mm-hmm. I have good days and bad days, but as long as you have more good days than bad days, you forgive yourself and move on. So overall, you have a healthier lifestyle,
I think if we could get most Americans to do what you just described, even 50% of the time, what would it be like? I mean, when you look at high blood pressure and how many people are on high blood pressure medications, the high cholesterol, the type 2 diabetes, just those three things, which are preventable and manageable risk factors for heart disease. But I know when you tell people that eating for your heart health, moving on most days, doing what you just said to do you think maybe it just sounds too simple and they think that can't work?
Yes, because in fact, I preface myself by saying that I know this sounds like, it doesn't even sound like real advice, but I promise you, this is what works. This is what I do to stay healthy. This is what I do for my family, my loved ones, my children, my husband, my mother, like my extended friends and family. This is what I tell them, and this is the only thing that truly, truly works. There is really no other magic formula, but some of us are unfortunate. We have come too far in the disease process. We do need medications. That's when make your medicine your food comes into play. So you have to religiously take your medicine and not, skip a day, forget a week, etc. Or not buy it because you think that it's too expensive. I mean, I wish I could tell all my patients who are women to join Red Heart Mamas, so I could teach them this on a monthly basis, because it's, once again, boils down to awareness and education. Because they don't know they can get $4 prescriptions at Harris Teeter, Walmart, Publix. They even get free medications for blood pressure management, blood sugar management, so, and then if that doesn't work, there's always an app called Good RX. So there are many, 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 many ways to stay healthy. But for some reason, I have found that the easiest thing to do is the most difficult.
Yeah.
I have seen thousands of patients over the years. I have given the same advice. In fact, I tell them, if you ever see me somewhere, please come back and tell me if you did this. I want to know if you did this,
Yeah.
It's that important and that simple. But like you said, it's almost too simple.
It truly is. Now,
Everybody expects a magic pill, a magic wand, magic dust. And I tell them, we're not genies. We don't do it.
well, and you mentioned, educating women about this, and you and I've talked about this before, is that the same advice that you're giving to us as grown women, we need to take that and apply it into our families, because by the time a kid is a senior in high school, most of them already have one risk factor for heart disease. 1 in 4 preteens in the US is pre-diabetic already. So what you're talking about doing, the sooner we can do this for our families, what would it be like by the time they get into their 20s and not be faced with, high blood pressure? I attended a roundtable with some national heart health organizations this week. And what we talked about is the fact that we're seeing more heart disease, high blood pressure, high cholesterol, type 2 diabetes, heart attacks, strokes in women between the ages of 24 and 34. And that was just, that was such sad news, because at that time of your life, that should be some of the healthiest times of your life. Are you seeing similar things in your practice?
Yes, definitely. Because nowadays most people are addicted to their screen time, whether it is their smartphones or their computer. And I mean, I have the same frustration with my children. They're 15 and 13. They have to do virtual school. Even when they're not in virtual school, all their homework is on a computer. And they get so much homework that they barely have time for physical activity. So I have struggled as a mother and a physician mother, because I'm constantly trying to apply everything I know for their good health. They get very frustrated with me because I say, you have to go out for 30 minutes. I don't care how much homework you have. And obviously, as teenagers, they don't like me to say that or force them to do anything, because they know better than everybody else, right?
Yeah.
What do I know? Nothing.
You've got great kids. I'm sure they listen to everything.
Well,
but kids are kids, and what they're exposed to during the day at school, and
so
all of the media and the advertising is it's a constant stream of things that are really bad for us. But it's what we're
kids
used
are
to.
on TikTok, Snapchat, YouTube,
Hmm.
Amazon Prime, and Netflix. And guess what they're advertising? Burgers, bread, chips, soda, fries. I mean, when was the last time they advertised some fruits and vegetables?
They don't, and so I know I was curious, because I know that you have a bit of a sweet tooth.
I
And
do.
how did you, and I know I went through this journey too, because not understanding when I had my heart attack, how much inflammation was in my body, and the impact that it was having, and what the root causes of that was. So I've gone through my own journey with sugar. But for folks that don't understand how addictive sugar is and what it does to your body, what it can do to your heart, how did you kick the sugar habit?
So it was very interesting. I never thought I will be able to kick the sugar habit, because I was one of those people. My husband used to say, "You're like a child. Every 2 hours you have to eat something." And now it makes sense. It's true. Because I would start the day with like, "Oh, it's just half a cookie," or "It's just this." But it actually used to, raise my insulin levels and make me crave for more sugar, because I would get hypoglycemic, low blood sugar. And so every 2 hours, I would have this intense craving that I have to eat something. And usually, what's easily available is sugar. So I was fascinated by intermittent fasting because, I heard so much about it. I researched about it. And, I realized that, they are doing studies, evidence-based studies at Johns Hopkins, and they have seen that it decreases inflammation when you do intermittent fasting. It decreases your risk for cancer, hypertension, diabetes, high cholesterol. And obviously, if it decreases all these risk factors, it can prolong your life. And it's almost like an anti-aging sort of effect. So I said, well, this is very interesting. And someone who would get hungry every 2 hours, I was like, I don't know how I'm going to do intermittent fasting unless I just force myself. And the first day, 2 days, week was tough because I was like, I don't know if I can do this. I don't know if I can do this. But then suddenly something changes. I mean, and of course, now I'm able to fast for 16 hours, sometimes even for 18 hours, and then only eat 8 or 6 hours. And I'm perfectly fine. I don't crave for food, nothing. So I'm not starving myself. I eat exactly what I want, but it's always healthy choices. Whether it's salad or legumes or grains or etc. Fruits, vegetables, protein, healthy protein, white meat. So I would eat. I'm not starving, so I'd eat healthy. But how do you get to that 16 hours? You start slow. It started with 12 hours, then 13, then 14, then suddenly you're at 16 or 18 hours. So you start slow. You cannot be hard on yourself. And then one day, aha, you're able to do it. And I used to love a little bit of sugar and vanilla creamer in my coffee. But I had to force myself initially. But then it happened naturally within a week. I was able to tolerate, I use the word tolerate initially, black coffee because I love my coffee. But then I went from tolerating to that's the only way I can drink coffee. Now, when I drink vanilla creamer, I can't because it has such artificial preservatives, etc., in it. I can immediately taste it. So, what I'm trying to say is there is a lot of bad stuff in the things we think are okay. They're not okay. So, we have to figure out a way to put that discipline in our lives. So, I would just say two things: you don't quit, and you have to hang in there with lots of mental discipline. It's mind over matter or mind over food.
Well, and we talk about, the word diet, which for a lot of women is a bad four-letter word. It simply means lifestyle, but because diet has come to represent, maybe, from a marketing standpoint, just another idea that somebody is out selling a book or video or a plan, and they try it, they lose a few pounds, and then all of a sudden they get bored with it and they gain all that weight back. So I think that's kind of the association. And what you're talking about, that I hear you saying, is really more of adopting that lifestyle, because when you do begin it, you got to give yourself time. But the more time that you do it, you kind of retrain your taste buds, and
Completely.
it becomes a lifestyle.
Completely. I
Yeah.
cannot, now, if you give me sugar, I can only eat a little bit because it's so sweet that I get nauseated. I cannot eat super fried food because I get nauseated because I have removed. And then I realized that these things are not good for you because if I'm getting nauseated, that means it's bad for you. So it's your body saying, listen, you're doing the right thing. Don't eat this. It's not good for you. And,
Yeah.
so it's really not as difficult as some people make it sound. You just have to hang in there. You have to be kind to yourself. If you fail one day, 2 days, it's okay. It's one day at a time, one step at a time, one bite at a time. So there is nothing to beat yourself because the whole world is failing on some days. And, it's okay. It's not a big deal. As long as you start portion controlling, eating the right things, you know, don't go hungry. fasting doesn't mean dieting. Once I start eating, I eat whatever I want that's healthy. So it's not like I'm preventing myself from eating something, but with a conscious effort that I'm not overdoing the calories.
So for some of us, we crave sweets. And I know, I'm postmenopause, so I'm in a different category. But I remember before menopause, you have those stressfuls, you have those times of the month, and some of us crave sweets. We've got to have the chocolate. Other of us, it's salty, it's carbs, and that can be just as bad for you as glomming on the cookies and and the sweets. And I know one of the things that I struggle with is I'll have a day when it's, hey, we're all busy, we're running, we're grabbing whatever we can grab, and the carbs are handy, they're easy, they're convenient. And God knows the fast food industry and the food industry as a general makes them very cheap and easy. So carbs are really easy. But if you're trying to eat healthy, too many carbs in your diet can throw you for a loop, just like too much of the added sugar. So when they say follow a low carb diet or a low carb eating plan, what exactly should you be planning in your eating plan to make sure you're getting enough carbs, but not too many carbs?
So we have to try to get our carbohydrates from vegetables and fruits and your, grains and legumes and, and lentils. But all the food groups I have mentioned are not very popular food groups, because people are used to getting carbohydrates from, white bread, pasta, rice, cookies, and, cakes, etc. No, they're not, cereal. People are not used to thinking of all these other food groups. And a lot of people don't even know what legumes and, grains are and lentils are. So if they don't even know what it is, they don't even know how to use it, right? How to make lentil soup, how to make legumes, etc., quinoa, because you have to try to find a way to eat the healthy carbohydrates. Our body needs carbohydrates, but the healthy, natural carbohydrate, not the man-made sugary carbohydrates, refined processed food, because that's where our whole system is going wrong, because we want everything instant. You just, pay $1. I mean, McDonald's has $1 menu. And why do they do that? Because they just want you to come buy that. You eat the burger, then you eat the fries, then you eat the shake. I mean, you basically have the worst carbohydrates and protein that you can find to eat. Obviously, they're not giving you any vegetables. I mean, you may buy a salad, but a lot of people don't, So you have to eat the healthy carbohydrates. I will never tell people do not eat carbohydrates because it's brain food. You need carbohydrates, So you have to try to eat, you have to keep fruits and nuts handy. Like keep it around. So I have a habit, I've started doing this because I had to teach myself to do this. I was too lazy to cut the fruits, but I had to teach myself, you're going to do this every morning. So keep a tray, a platter of fruits ready to eat. So I force my kids and husband that every meal you have to have a small spot for fruits. So keep it in your plate so you don't overeat the other food. So the fruits have to be there. So you have to make these little adjustments in your day on a day-to-day basis to make sure you're incorporating it in your diet. It's very hard initially, but after a point it becomes, your daily routine. So it's not very hard.
I know one of the questions that women often ask is, because I've had this one posed, and I'm sure you have too, from spouses, when we talk about incorporating eating for a healthy heart. And the great thing is when you take care of the heart, when you eat healthy, when you move and do what you're supposed to do, it also prevents so many other diseases, even some forms of cancer. So you're eating for your whole body when you take care of your heart. but there'll always be that one woman in the back who says, I can't get my husband to do this. I can't get him to eat right. I've tried and I just can't. So, how do you handle that? I know for us, what we've had to do, especially, with my husband's health issues, is if we know that item is a temptation for us, we don't buy it. We don't bring it into the house because we know if we do, one or both of us, we're going to eat that. But how do you help women who get that kind of pushback from their spouse or their kids about incorporating more healthy eating into their menus, into their eating plans?
Well, it's tough. But since I'm in charge of grocery shopping, so I kind of give them an empty threat, sometimes a real threat, that if you don't eat your fruits and vegetables, I will not buy your favorite items. And I limit the number of times I buy it in a month. So they love, one of the Kellogg's cereals. So I said, you can eat it once a month. You make it last that one packet as long as you want. I'm not going to buy it more than once a month because it's processed, there is food colors in it, etc. But since you're saying I'm stealing their childhood by feeding them healthy food, I said, okay, I'm giving you back your childhood. Here, you can make this last as long as you want. So now they know that this is sometimes an empty threat, sometimes a real threat, that if they don't eat their vegetables and fruits every day, every meal, I will not buy the other stuff, which is, meat items, etc., etc. And so it worked. And then with my husband, I said, you have to be a good role model for the kids. I mean, you cannot behave like this, So, and then I said, I'm not a chef. This is not a restaurant. Everybody has to eat whatever I make.
Or learn to cook.
Or learn to cook. Exactly. So I tried to use these techniques, and by grace of God, it's worked. Like this morning, I bought this chickpea wrap with, arugula leaves. Of course, you get it pre-washed, and I did boiled egg. And put a Parmesan cheese on it and wrapped it, and it was a nice, amazing, egg wrap. So got some greens in there, and then I gave her some watermelon on the side. I said, this has to happen because otherwise it drives me crazy.
They'll thank you when they're older, I'm sure, and they know mom is right, but it's very difficult, and I can see. For some families, especially when you go back and you look at the cultural impact that it has on, especially for women of color, that in certain communities, what they're used to eating, everything's fried, everything is deep fried, everything is, I remember growing up in the Deep South, and your grandmother always had an old coffee can full of lard. I mean, that just, yeah. Growing up that way, and it's like you just cook everything with that. We always thought it was grandma cooked with love, but actually grandma was cooking with lard. And but you look at the diets over the years, and you look at the residual effects of that as we get older. But it's very much of what we put into our bodies, what we do for our bodies, that's going to have that long-term impact. So just thinking too, because beyond even, we talk about taking care of our hearts, of course, because that's our mission. But what are some of the other issues facing women today from a health perspective that you're seeing more and more in your practice? And what do some of the women who may be watching this now need to know?
Oh, you mean besides heart?
Mm-hmm.
Well, I think the risk factors for heart, hypertension, diabetes, high cholesterol, stress management, it sounds like it seems like, the whole world should know about this by now. as much as knowledge, it's there on the internet and as many podcasts and everything that everybody listens to and awareness programs, etc. But still, most people that I take care of are showing up to the emergency room with blood sugars in the 400 when it should be like less than 200 or even 100 fasting. And their blood pressure is 200 over 100 when it should be 130 over 80 or 70. And the cholesterol is way beyond 200. And their stress is through the roof. So now you're stuck with this 45-year-old woman who is, of course, stressed because she has to work, she has to manage the kids, and she has to take care of herself. But guess what? She forgets to take care of herself because, everybody blames their fatigue on allergies or lack of sleep or stress. But a lot of times the fatigue is because they have high blood pressure, high blood sugar, and high cholesterol and underlying heart disease that they have never gotten it checked because they're only 45 and they didn't have the risk factor, but now because of their lifestyle, they have risk factors, not just factor. So it's multiple risk factors. So I think this is why I'm so passionate about it, because it's so preventable. It's almost too easy, but people ignore that, and then they bring themselves to that point where they get a stroke, because stroke is also the same risk factor. So, I think intermittent fasting helps with that too, and even with, menopausal symptoms, it helps because now you're eating better, your weight is better, everything is better. It regulates your hormones because it regulates all your different enzymes and hormone levels when you do intermittent fasting. So it's a very interesting topic that we should, educate and raise more awareness, because the more people hear about the benefits, even for me, like I said, it's unbelievable. And we should really focus on risk factor management, not just talking about heart disease prevention is incomplete without talking about how to, take care of your hypertension, diabetes, high cholesterol, stress, because a lot of people, patients get chest pain and unmask their heart disease because they had so much stress. The stress raised their blood sugar and their blood pressure, and now that is giving them chest pain. So this is why they say stress kills, and I promise you, after being a medical student and a resident and now an MD for 17 years, which is almost like 25 years in the whole, if you start counting all the years, this is it. You have to do stress management. And if you learn that, you automatically do all the other things right. So it seems, like I said, I keep saying it sounds too easy, but it's actually the toughest thing to do.
It is, because I think there are some women who, when you talk about self-care, we're notoriously bad about practicing self-care. And there are some women who actually feel guilty if they take time for themselves, because they have that, maybe that's how their mothers were. Maybe that, part of their culture.
Because we're supposed to be thinking of everybody else, and we haven't been taught to think of ourselves. Mm-mm. In fact, I remember when my mother came to visit me, and I was busy handing out vitamins to everybody, and my mother said, "Did you take yours?" And I realized I never took mine.
It's true, and you see those young, especially the young mothers, and I remember those years of raising the kids, and you would get home from work, get dinner done, get baths, get homework, make sure they got their tests, they were studied, get them to bed, and then you were up another few hours, dishes, laundry, and it's just go, 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 sleep a few hours if you can, get up and do it again. And that becomes our routine and our cycle until one day we wake up and we realize, wow, I have not taken care of me. So I appreciate the fact that you encourage women to take care of themselves and to take that time out to meditate and to do yoga. And we definitely, I think we could do a whole program on intermittent fasting because I see a lot of information, especially out on social media about it, but making sure if that's something that women want to do, knowing how to do it and doing it the right way. So that it's beneficial to them. I think that might be a topic that's very interesting too. And as we're looking at women's health overall, from the time that our young daughters are becoming women to the time that we are becoming the older women, trying to teach the younger women and encouraging everyone in between to take care of themselves. What we want to do is increase that awareness. I think I shared with you earlier that through that roundtable, about 10 or 15 years ago, about 61% of women in America understood that heart disease was her biggest health threat, that's our number one killer. But they shared with us this week that that number has dropped to 44%. And if it's a woman of color, it's down to 35%. So Red Heart Mamas, we have some work to do. We have got to get this message out to the women in our lives and in our communities that yes, heart disease may be our number one killer, but as Dr. G has shared, there are very simple things that we can do to prevent it, but also to manage the risk factors that we do have, and we want you to take action. One of the things that we've been hearing in the news media, especially in the last year, is that because of this pandemic, a lot of people aren't getting their physicals done. They're not getting their heart health checks done. Are you seeing that in your practice, or is that starting to change and pick up a little bit?
It's picking up a little bit, but yes, 100%. People were missing their appointments because they were afraid to go see the doctor, because doctors were also only seeing the sickest of people, and they were doing virtual care. A lot of people were not comfortable with virtual, because, just like my dentist tells me, taking care of your teeth is 90% at home. Similarly, even our health, whether it's hypertension, diabetes, cholesterol, weight, anything, is all can be done at home. So you really, even though we're going through a pandemic, we should be making an extra effort to seeing our doctors virtually. It's okay because, it's successful. We have managed COVID-19 patients in an ICU virtually. So we can definitely do preventive medicine virtually. It's possible. Anything is possible because, a stitch in time saves 9. So my goal is that you just need 1 stitch and not 9, because I don't want people to come to the emergency room because this advice could have changed their life, in the easiest of ways. Take your medicine right, eat right, exercise right, sleep right. Most people are not even getting their 8 hours sleep. They are only sleeping 5 hours, and they're proud to announce that. And I'm like, don't be proud of that. That's terrible for you, because they feel like they're so amazing, Herculean effort, etc. So, you have to keep up with your appointments, because that's how you pick up on the bad stuff. That's how a doctor who has a good relationship with you knows, like, oh, you don't feel this is not right, that is not right. We can talk about it, do the right test, and, fix it in time before it becomes too late, or you end up in an emergency room with blood pressure of 200/100, which was completely preventable. And because once it's 200/100, now you're at risk of stroke, a heart attack, heart failure, kidney failure. Why are you doing this to yourself? And, your body will never go back to normal if you push it that far. You'll always be a little sick. You will never get to normal. If you're lucky, you will, but you don't want to push your luck.
No, you don't, because as we very often share, about 80% of those who have a heart attack before the age of 65, we don't survive the first one. I'm very blessed. I did, but I was in that 20% who survived. But so many of us don't know that we have heart disease until, like you said, you wind up in the emergency room. And that's what we want to stop, because early detection saves lives. And it's amazing how we will, that is a mantra, and we will focus on that for a lot of other diseases. But when it comes to heart disease, we don't think of it that way. But the sooner that you get in and you get those heart health screenings done, you know what your risk factors are, you can begin to work on those. And a lot of that goes back to what you put in your body, what you do for your body, taking that medication as it's prescribed, doing what Dr. G is telling you to do, and you can stop the progression of the disease. You don't have to be a heart attack or a stroke survivor, and you certainly don't have to die prematurely from a largely preventable disease. And one of the things that is so much in my heart is to make sure that our children and our grandchildren and future generations aren't plagued with this, because it's not necessary.
Exactly. It's not necessary. And actually, you can eliminate the risk factors if you do these simple things, which, of course, by now we know is the toughest things, because people are so addicted, unfortunately, to fast food. And, it's really hard to cook every day. So
It is.
And I think, it brings me to my favorite topic nowadays is teaching my children to cook. So they are I call them, you have to be my happy helpers. So I call them, like today in the afternoon when I made some food, my son chopped the onions and, he did the dishes for me, and, he prepped the vegetables, because I was making the food. So teach them, be hands-on. And when I'm teaching them, I tell them, okay, what nutrition did you get from this egg? Is it calcium, vitamin D, and good cholesterol, and then the arugula leaves? So I keep throwing in, nutrition talks while we're eating every day. And if I don't know there's no way everybody can know every nutrition fact. Even as a physician, I don't know every nutrition fact. So then I Google it.
Yeah. We do a lot of Googling for sure.
And YouTube is there always ready to help you with all kinds of recipes. So actually, we live in amazing times where it's very easy to learn and do the right thing. But in spite of that, we are in challenging times because of the media, the fast food, and the fact that they keep throwing these images at you on TV, internet, TikTok, Snapchat, buy this, buy that, cereal, sandwiches, fries, mac and cheese. I mean, you name it. It's all not in moderation. It's okay, but not every day, twice, So, and you have to teach your children to eat from the side of Harris Teeter or Bilo or wherever you go to shop. Don't go in the middle aisles. Go on the periphery. That's where all the good stuff is: the fruits, the vegetables, the meat, milk.
Exactly. I think there was a study that came out a few years ago that said that if they removed all of the overly processed frankenfoods, the foods that don't have, they're not real foods. They're produced in a lab. It's the colors, the taste. Nothing about them is really real. They're not really nourishing your body. If they removed all of that out of a grocery store, only about 20% of the grocery store would be left. And that would be that perimeter. So if you all are watching through the Red Heart Mamas Facebook group, if you have a question, we're going to close out here soon, but go ahead and post your question in the comments, and I'll grab that and pose your question to Dr. G. But one last question that I wanted to bring up to you is when we talk about, women's health, and one of the risk factors we do talk about, we talk about age, that the fact by the time a woman is 55, her risk for heart disease is higher, and that is back to menopause and hormones, but also the ethnicity, that women of color are disproportionately affected by high blood pressure and high cholesterol, diabetes, and heart disease. And, when you look at the African American, Native American, Asian, and Hispanic, of the high numbers of heart disease within those groups, Do you have a sense of what is causing that? Is it strictly genetics? Is it just in their DNA? Is it culture? Both?
I
What is
think it
that?
is a lot of it has got to do with awareness and education and accessibility to fruits and vegetables because of their socioeconomic status, the areas that they live in, if you notice, they do not have access to fruits and vegetables. It's usually fast food. So they are eating all the easily available food that's not so good for you. And that's one. And they don't even know that it's not good for them. And they are busy, moms, single moms raising kids. So they don't have time to think of all these things. And so we have to create this awareness of, and this is why they have actually mobile, in some cities, they have mobile vans. There are some organizations that are doing this. They go to these areas and just donate fruits and vegetables because they don't have access to it. So it's and some of it is maybe cultural, like growing up, even we used to eat a lot of fried food, but now, the awareness, education has increased. And so we have stopped, we've gone to the other extreme of, being very healthy. So I think it's a combination of things, but definitely what is being noticed, they've done studies on this, that their accessibility to fruits and vegetables is much lower. In fact, they have to drive like 10, 15 miles to get to it. Whereas for us, where we live, it's 2 miles away or a mile away. So it's everywhere. So that's been one of the major factors. So they're even in some cities trying to teach them how to do farming in their own backyard or, wherever they have a space available so that they grow their own vegetables, so they have access to it. And also, they have to be taught how to eat right. So it's a combination of things, but the accessibility has been the most. And also, unfortunately, fruits and vegetables are the most expensive, just like organic food.
Mm-hmm.
So that is also a major player in it. So even if they want to buy it, it's too expensive.
And that's sad. It truly is the very thing, because when you look at those groups that have the highest incidence of those risk factors that need the fruits and vegetables and accessibility to those things to help prevent those diseases and help heal them, what a terrible cycle. And I know there are so many groups that are involved in those kind of feeding programs, are creating community gardens. And if there's not one where you are, I'm sure you can find some people to, for the ladies that are watching, to get involved, to make that happen in your community. That is a great sustainable way of helping, those families. So I don't see any extra questions in the comments section, but this has been great talking to you. I'm sure it's very much like when we do programs, and after we finish, there's going to be several people that thought, oh yeah, wish I'd asked that. But we're going to plan on doing this again. And we're going to ask the group if there is a subject like intermittent fasting, for example, that they might like to know more about, and to get them engaged again. Do you have anything that you would like to add in closing?
All I can say is, we have to continue doing the hard work of awareness and education. And, even if we save one life, one mother, one sister, we would have done a great job. And I think we can easily do it by inviting more of our friends and family, women in our lives, to join Red Heart Mamas and support Sheila Caldwell in her calling. And I'm very excited with this privilege of, spreading the awareness and education on this very, very important topic. So thank you very much for this opportunity.
Well, thank you, Shantala. I appreciate it more than you know. And so I'm going to close this out real quick. Thank you all for joining us. and for being
Thank
a part.
you, Facebook audience. We appreciate you, and thank you, YouTube audience, and we will see you soon again.
Awesome. Thank you guys so much. And if you do think of any questions that you wanted to ask, either on the replay or in our Facebook group, just feel free to do that. And in our next Doctor Chat, we will pose those questions.